Welcome to another edition of Professor Speaks. Today we're going to be talking about how deaths from drugs, alcohol, and suicide are now outpacing diabetes. But before we get into that, I'd like to remind you to hit like, subscribe, and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And today our topic is how deaths from drugs, alcohol, and suicide are now outpacing diabetes. And Dr. Stern, if you could help me here, what are some of the stats that support that topic?
Yeah, we decided to do this topic today because the CDC, the Center for Disease Control, has come up with some new studies that have identified that deaths from alcohol, drug overdose, suicide, have now outpaced, as you've indicated, or the incidence is greater than that of diabetes. So it brings up a real problem. The problem is, as healthcare people, we've always had to deal with societal issues.
Right.
Whether they're behavioral issues, whether they're drug issues, alcohol issues, marijuana issues, or whatever. But now, what we also are addressing is that the very common disease issues, like diabetes, are now being overwhelmed by what's going on in societal issues.
Right.
And so now we have to try and figure out, how do you deal with this? Because alcohol affects drugs, opiates and overdoses affect drugs, suicide is being treated presumably with drugs,
Right.
so it's part of it. And so it's not that we don't or trying to ignore it, it's bringing the issue up because we need to address the fact that societal issues in some cases may swamp what some of our medical issues are.
Right, and it's curious on a couple of different angles because I remember we were talking about last year about how high the rate is of diabetes and how prevalent it is in our society today. And now we're talking about drugs, alcohol, and suicide and how people are actually dying at a higher rate than those that are having diabetes. And diabetes is it's still prevalent. It's still a problem in our society, but it doesn't seem to be as much as drugs, alcohol, and suicide.
Well, you asked me what's the rate, and what I did was we took several things that were linked to the Centers for Disease Control, and M will attach them to this email so that people can see what these rates are. So for people that are posting, so that people can see that if you want to see the real data. The reality of this is that this is real data, real information, real surveys, and in general, it may be even lower than what has been posted because some of these things are not being reported. So issues with regard to suicide, for example, may take a long time for people to decide. You were saying this to me earlier.
Right.
May take a long time for people to identify that it's suicide versus some other means of death.
Right, because the dead can't speak for themselves, so it's hard to figure out how it is exactly that they passed away.
Exactly. Yeah. And further is that many of these things either people have not reported or they're not part of the total numbers that the CDC is collecting. Irregardless, the numbers are large, and we're dealing, as we talked about with diabetes, that very potentially a third of all people have some sort of an impact from diabetes, whether it's in themselves or a spouse, a child, or otherwise. Well, when you're looking at that and you see the total volume of what's going on, clearly there has to be some intervention. Medicine cannot solve this. Pharmacy cannot solve this. Certainly hospitals and nurses cannot solve this, but certainly we have to be involved in it because while we're also trying to treat a significant disease, trying to save lives, and
such as diabetes,
and making it more comfortable and fair so people can lead an activity of life that is appropriate for their lifestyle. Now we have to think about what else we can do so that we don't complicate the treatment of the condition, but also that we also address these problems that are becoming just as big as everything else that we're treating.
Right, and then, but when we bring up drugs, because drugs has obviously some kind of negative connotation to it. We're not just talking about recreational drugs, are we?
No, we're not. We're not. We're dealing with the fact that the rate of legitimate legal drug abuse is higher than that of illegal substance abuse. Why? I mean, there's a lot of reasons for this, but in a general way, drugs are easy. I mean, you go to the doctor, you get prescriptions for it, you use it, you don't use it. You may, in some cases, have it in the medicine cabinet. Members of the family can take it, or otherwise, and so people that may not have been prescribed for that particular drug are getting it.
Right.
Maybe that someone has decided that it wasn't working for them. They want to use more of that particular agent, or decide how they want to handle it. We certainly look at when we're doing all of our screening clinically every month with all of our different clients. We look at compliance. We look at the risk factors of drugs that are creating adverse drug effects and all of that.
And also pharmacy shopping as well.
Pharmacy shopping, all of this leads into it and leads us into a problem. I'm trying to simplify this so we don't make this so complicated.
Right.
But at the end of the day, what we're trying to do is to tell people that these are serious issues. They're not issues to be just kind of put under the carpet and ignored, that you have to address it. So the real problem that we have to address is what do you do about it? How are you going to address it?
Because we are seeing it more and more, and it's happening to those with high profile, like where we're seeing celebrities being caught up in deemed suicide or overdosing off of legal drugs, not just illegal drugs. And it's becoming more prevalent in our society, sadly, and then we don't see it, but it's happening more and more, not just to these celebrities, but to regular people in society.
Well,
go ahead.
It's kind of a double-edged sword.
Yeah.
This is tragic. No matter how you slice it, this is tragic. The issue that we have is that if celebrities get involved, it's tragic for them. It's certainly tragic for their families and what goes on.
Right.
But it also raises the level of awareness of what's going on. So people realize that, well, if it can happen to so-and-so, then potentially it can happen to me or my family or otherwise. And in that regard, it becomes more tragic because you're multiplying the number of people that are involved in what goes on.
Right.
That's even worse than what already happened, which was tragic enough.
Right, and then what this does bring up is what we have talked about in the past. We talked about it a couple times when it comes to mental health awareness.
Right.
And a lot of mental health issues are being treated with prescription drugs.
They are.
Which could be dangerous.
They are. I mean, in today's society, mental health seems to be the whipping boy for whenever there's a problem. There's a shooting, there's whatever that goes on. It's because the person was crazy and because they had some mental problems. The reality of it is that the total number of people that have mental problems, the total number of societal issues are not the same. The mental health problems are much smaller than all the societal problems. Okay. But that doesn't stop things from happening.
Right.
Whether you're not depressed or psychotic or anxious or whatever, that these things can still occur. And we have to be aware that all of these things kind of multiply. What the CDC data did indicate, which is different than what was found when they did these kind of surveys 10 years ago, etc., is that all of these things are now related.
Right.
It's not just looking at the people who are taking or drinking too much alcohol. It's not just the people who are using too many drugs. It's not just people who are suicidal. But in this particular case, every one of them had links to each other. So issues with regard to alcohol also had issues with regard to medications. Depression clearly had issues with regard to the level of treatment and what was happening. So they're also indicating that this isn't a one solution problem. It's not the Lone Ranger coming in with a silver bullet and solving it with one bullet. We're dealing with multiple problems and they're all related. And this kind of data is indicating that you can't ignore one without dealing with the others.
Well, and we've been talking a lot about how in a general form, because we only have a limited amount of time, but can we look at some of the demographics that this is falling under? Because there's certain populations that you see an increased risk of suicide attempts or drugs being involved in their deaths in one particular population, right? We're looking at teens.
Yeah.
And
Well,
it's even more tragic that way.
Well, it's even more so, and you're right, Alex.
Mm-hmm.
This issue of what's going on used to be, in general, and this is a very broad generalization, used to be in a Caucasian population. But now the rate of increase of what's happening in the Black African American population and the rate of what's happening in the Asian population is greater in the trend, in the speed, than what's happening in the Caucasian population. So it's now affecting other cultural centers. So it's no longer, well, this is a white problem, it's a Hispanic problem, it's a Asian problem. This is everybody's problem.
Right.
And the rate of it happening, the actual numbers may not be as high, but when the rate is increasing, then we realize that these kind of things are beginning to impinge on all of those. Now, clearly, there's a huge issue that is going on, tragically, with younger people, and especially those up until about age 18, at the age of adolescence.
Mm-hmm.
But and that is tragic enough already. But it also means that there's adults, there's younger people that are involved, there's different cultural groups that are involved. This is not something that we can just wash away as it's their problem. I don't need to worry about it. It's your issue. I can stand back and I don't have to worry about that problem. This is everybody's problem.
Right. So how can us, maybe healthcare professionals or even parents out there, how can we start looking at all these as being related? How does one do that?
Well, the first thing that we have to deal with is educate and communicate. We've talked about that a lot. Yeah. We talked about it with regard to prevention, which is the primary way of handling this before you deal with drugs, before you deal with other medical services, etc. Mm-hmm. You have to communicate. It means that because the rate of incidence is going up so fast for these other problems, it means that everybody has to communicate. It means that pharmacists have to communicate, doctors have to communicate, nurses have to communicate, and others in the healthcare system have to communicate.
Right.
The other issue is that we not only have to communicate, but we can't just say, oh, don't do that, don't drink, don't use alcohol, etc. We've all had different ways of doing it. I'm not saying that one way is any better than another. I had a patient once in a hypertension clinic who said to me, I'm not an alcoholic. And I said, well, here, according to this, you drink half a gallon of wine every day. And he says, yeah, but it's wine, it's not alcohol. And so you have to begin to change certain perceptions. Mm-hmm. And medically, we can talk about what those perceptions are and what has to be done. So communication is number one. There's no difference in it. And it means that every time that there's a touch point, a physician sees a patient, a pharmacist sees a patient, and pharmacists, by the way, see patients about 3 times for every time they see a physician. And certainly nurses, etc., have to bring these issues up so that we're not ignoring them, well, the only thing you have is your diabetes, and so I'm only going to talk to you about diabetes and how to prevent diabetes. I've got to talk to you about the other things as well.
Right. And that's important, because we've talked a lot. Almost every topic has to deal with the communication between the patient and the doctor, or the patient and the pharmacist, or even in some cases the pharmacist and the doctor communicating to present the best possible therapy for the patient. Yeah. So, we talk about it nonstop. It's always communication. You do have to ask questions. Asking questions is important. Or relaying what's actually going on. What are you feeling in your body, or mentally, in this case, where we talk about mental health disorders, being honest about what's going on, or what are you thinking about.
Yeah.
And a lot of the behavioral health professionals also need to communicate as well.
They do, yeah. And clearly also the political people, legislative people, the health departments and others need to have appropriate materials for people to hand out so that people can read it. Hopefully they don't just throw it away when they get it.
Right.
But the more that people communicate, the more that people will begin to pay attention. And only as an example, and not to make anything, the issue of opiate abuse has now become a cause célèbre for everyone.
Right.
The medical community created this problem, and now we have to solve it. But in doing so, if you talked about it 7 years ago, most people would say, yeah, it's a problem, and we talk to people, and that's it. What's going on now is because the attention of everybody is on the topic, because everybody is bringing it up. Now it is a cause célèbre, and doctors are paying attention, and pharmacists, and drug wholesalers, and drug manufacturers, and hospitals. Everybody's paying attention. So what we have to do is to raise the level of attention, not just communicate, although it's absolutely critical, but also to raise the attention of these things so that people understand just drinking, there is a limit, there's a difference between a social drink and drinking constantly. There's differences between
and
appropriate drug use.
Definitely alcohol.
Absolutely. And then clearly asking people about depression, etc. Because at the end of the day, someone can say, "Oh, this is horrible. I've had a horrible day. I want to kill myself." Okay. But when someone tells you, "I have a plan,"
right?
Whatever that plan is, I've got pills, I've got a gun, I've got a knife, I've got whatever. When they tell you there's a plan, that is significant.
Right.
That's serious. So clearly there's a level of differentiation where people have to make up their mind. But at the end of the day, you've got to be able to keep the impression of it. Everyone has to raise the level of interest in it. There has to be materials about it. So the patients get it, doctors get it, pharmacists get it, nurses get it, and everybody has to get it and raise the level. This is important when we have this kind of a problem that's bigger than diabetes that is increasing. We really need to take and pay attention. We can't solve it all,
right?
But we do live in society, and we all have to pay attention to that society, whether it's for us, our spouse, and certainly for our children.
Of course. And prevention is key in here. And prevention comes from awareness.
Yeah.
Like, if you're aware of it, you can read the signs. You can be able to, if you know somebody who you feel they might do harm to themselves. I mean, there's someone to talk to. Well, I'll have M post up our producer M. Well, she'll put up the suicide hotline number. If you know somebody, you can definitely call somebody. You can talk to somebody. You can reach out to somebody. There's healthcare professionals all over the state, and there's always someone to talk to. Even drugs and alcohol as well. There's someone to talk to about people abusing those as well. So we want to bring down those deaths and get back to focusing on therapy, right?
Yes, we do.
Right.
We've talked a lot about prevention in the past. That's the easiest, cheapest, most direct way of handling disease. And it's not just about vaccines. It's not just about education. It's not just about trying to make sure that everybody's blood pressure is within normal limits or their blood sugar is within normal limits, etc. It's terribly important that we bring in the societal issues too. It's like writing a prescription, and the prescription has perhaps certain drugs that you're using to treat diabetes, and then certain things you have to do with your activities of daily living, and certain things you have to do with all of those other risk factors, so that you're writing a prescription has multiple elements and telling people they got to follow it.
In a prescription, you can put down the drug they take and then tell them to exercise for 30 minutes?
Yes, you can.
All right, I like it. All right, so that's all we have for you today. Thank you again, Dr. Stern.
Thank you.
And I hope you found this information useful. If you have any questions, please feel free to comment below or message us directly. I'd like to remind you to go to ProPharmaConsultants.com. We'll have the link down below, and don't forget to like, hit subscribe and hit the little bell for notifications. We'll see you next week.